Adam, so tell us a little bit about yourself.
Hi, Dr. Taruna. I guess for me, my background, my context, my story is someone who has always been very involved in athletics. I used to be a runner. I used to be a power lifter. I biked a lot, and so I just from a very young age, 14, 15 years old, all the way up until here recently, within the last 2 to 3 years, I would describe myself on that spectrum as being a very active person.
Right. So tell us a little bit about your back problems, and your kind of how were things before with your back problems and, being the sciatica symptoms.
Sure. So the back pain problems were severe to the point where I've had several injuries throughout my life, and those injuries you feel as though you can recover and bounce back from them. The type of pain that I had with my back injury is the type of injury that really made me feel, not so much when will I work out or how will I work out, but if I will work out. So really at that point, by the time when I first came here and first started, my focus was on just trying not to have any pain. It was I would say pretty severe.
Yeah. So in the last few years of having these issues, what were some of the different treatments you tried? What worked for you? What didn't work for you?
Sure. Well, the major problem at first was just simply diagnosing it. I did a lot of rehab for my hamstrings, which was totally inappropriate for the injury that I had. I did some rehab for my back, but a previous experience with that did not include the McKinsey method, and as a result, I really wasn't actually working the problem that I had really at its root cause. So I would say a lot of misfirings as far as my approaches are concerned, and those that were on point with my back, I don't feel that they were catered to the actual injury that I have.
Sure. And then how have things changed since the time we first met? We started with that back pain workshop to now it's been a little over a month, I think close to 5 to 6 weeks now. How have things changed in the last 1 month?
Sure, in a month I would say drastically. I would say in the time that I came, that question I think might be better answered with just mindset right offhand, and that is the idea that I feel as though living without pain is definitely in my future, and at this point I'm starting to get into the process of, like, I'm biking again on the Peloton. I am walking without any pain. I'm basically living day to day without pain, and the pain symptoms are becoming very few and far between. So my body is telling me that I'm ready to start moving again. So I'm right at that moment where I'm starting to return to my more natural, my more normal self.
Yeah.
So it's been a pretty significant transition.
Yeah, no, and it's so much of your work because you have implemented the things that we've laid out for you. So I think a lot of it is also you. What would you like to say to someone who's on the fence, who's been sitting with these chronic back issues for a long time, losing hope like you were a month ago, that they would be stuck in a cycle of pain, injections, having to take some sort of medication for the rest of their life?
Yeah, what I would say is that if you're anything like me, there's this sense of that you're having pain, you don't know where it's coming from. And it's that sense of not having the knowledge of how to deal with the injury that you have. And naturally, that's a very debilitating feeling because not only is it painful, but you also don't know how to deal with that pain. It comes so randomly. So the big shift for me really is a sense of knowing where the pain comes from, knowing how to manage it, and knowing that, having that knowledge on an anatomical level. So that's the real, I would say, if you're kind of sitting there thinking about, where do I go from here? Is there an answer? I've been really super impressed with my own empowerment, with my own life, with the knowledge I now have moving forward with how to deal with the injury that I have. It doesn't feel so much like one so much anymore these days.
Yeah, thanks so much for sharing your story, Adam.
Sure, anytime.